diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, everybody. I'm Greg Keeley. Welcome back to another You and Your Doctor program sponsored by All County Healthcare. Always here for your home care needs. Medicare certified, serving Miami-Dade, Broward, and Palm Beach counties now for more than 20 years, rated 4.5 by Medicare.gov. Find us at allcountyhealthcare.com. Well, tonight our guest is urologist Dr. Raymond Levely. Doctor, we appreciate you being on the program tonight and taking time out of your very busy schedule. South Florida is the beneficiary of having this specialist practicing right here after going to school in the Northeast, the Warren Alpert Medical School of Brown University, Providence, Rhode Island, University of Massachusetts Medical School, then back to Providence for a residency. Doctor, could you tell us a little bit more about your education and then the subsequent fellowships?
Yes, thank you, Greg. It's a pleasure to be here tonight. After the residency program, I saw that the future of surgery was going to be minimally invasive surgery. And at the time, urology had no footprint. It was really laparoscopic cholecystectomies and some general surgery procedures. So I sought out a fellowship in laparoscopic urology and advanced kidney stone disease. So that whole field is termed endourology or endoscopic minimally invasive urology. And the fellowship really changed my life because it launched an academic career. I moved to South Florida and I was on faculty at the University of Miami for 20 years. I was able to get a tenured faculty spot. I had a lab, and it really was the launch of a lot of new products, both lasers and endoscopic equipment, and eventually into robotics, which I've been practicing now over 20 years with robotic surgery.
Well, that's really wonderful. And already when you came back here, you immediately dove in and started giving back to the community in terms of helping medical students thrive and grow in their program. So that's very admirable. We appreciate you doing that. It sounds like there was a lot of blood, sweat, and tears that went into that through the years, in addition to your regular practice.
Well, I don't know if it's blood, sweat, and tears. I mean, when you do something that you enjoy, it's really just giving back, and teaching is a great honor. And after leaving Miami and moving up to Boynton Beach, we also have an affiliation with the FAU Medical School and the residency program there. So the teaching hasn't stopped. It's just not classroom teaching. It's on-the-job training, if you will, and you mentor 1 or 2 people a year, and you teach as many as you can. So it is rewarding. There is satisfaction with that.
Understood. That's very vital in this day and age for sure. And so during our pre-interview, you mentioned how we have health observances for a number of disease states in whatever month or week of the year we happen to be in. You want to make sure that we know that an ounce of prevention is worth a pound of cure when it comes to Kidney Month, which is in the springtime. Could you speak to that and that importance and the awareness of that, and people realizing that they need to get checked when they feel like something maybe isn't quite right?
Yeah, I brought that topic up because everyone's familiar with the pink shoes of the NFL players. And for many years, the NFL had helped sponsor Breast Cancer Awareness Month, which is in October. And the American Urology Association, because men's health is important as well, for several years had the NFL don the blue ribbon of Prostate Cancer Month, which is in September. And I just kind of noticed this year that they don't sponsor any particular cancer. They feel that all cancers are important. So you'll notice on Sundays, the end zone has a rainbow color. And whether that's to be all inclusive or it has other implications, I don't know. But their marketing scheme of a crucial catch, I think, is really keen, because it's the catch that allows early diagnosis and early treatment. And with early diagnosis and early treatment, you get better cure rates. So the whole point of the marketing, I think, is to help people be aware that there's support on a large level from private industry like the NFL, but also that locally there are fundraisers, and they just had a breast cancer march in Fort Lauderdale this past weekend. And so the funding supports the programs, but also goes towards many different research endeavors, not necessarily lab research to look for the cure, but there are a lot of clinical support that's needed for cancer patients. So I found over the years that those donations that come in, and I'm not here trying to raise money, believe me, I don't have a foundation, but I do think it's important to continue, and that those monies are very well spent.
Right. And you, in treating this disease through your tenure, have realized how important it is to for your patients to recognize when something just is not quite right. Could you expound upon that a little bit more?
Yeah, I would say that about half of the people that we see with renal tumors find them by accident. And they go to the doctor and they may get an ultrasound for abdominal pain, or they may go to the ER and get a CAT scan. And so we find a lot of incidental things. And oftentimes those scans are very brief and limited, and patients may be alarmed because they're told they have a lump and they need to follow through. And most of them, fortunately, will go and get a consultation with a specialist after they leave the emergency department or their primary care doctor. And then the other half of patients may have, at least the ones that I see, may have something called microscopic hematuria, which is undetectable blood in the urine to the naked eye. And those people also may have benign conditions, but they should see a specialist as well to evaluate and get a proper workup. And then the third group are the ones that have symptoms, either pain or they see blood in their urine, and that can be from many different sources. And so I would say the big mistake would be to say, well, it only happened once, I don't need to go and follow up on it. Just one time of blood in the urine would be sufficient to get a thorough workup, which typically involves a CAT scan or an MRI, some lab work, and then an office physical exam and endoscopy.
Right. And sometimes you learn or read about people who've ingested, let's just take diet beverage, for example. Let's say you're addicted to Diet Pepsi or something like that, and you drink them, let's say you drink 5 or 6 a day or something like that. Can that have an impact over time on your kidney performance? Could you speak to that a bit?
Yeah, I think that hydration is the key. And I tell people it doesn't matter what you drink as long as you drink something. So the solution to pollution is dilution. And so I would rather a patient, especially a stone-forming patient, drink the wrong fluid, but a lot of it to flush their system. It's been said that dark colas have a high amount of something called oxalate, which can lead to kidney stone problems, and it may alter the body's chemistry, the pH, and the balances, so that soda is probably not the best beverage for you. But if you have a Diet Coke here and there, everything in moderation is going to work itself out. I just think that extreme diets, extreme following of medications or over-the-counter remedies is probably not a good way to go. I've always thought of the life in the food pyramid. You know, you get the basics at the bottom, and then you can alter a little bit. But as far as kidney cancer or prostate cancer or bladder cancer, I know of no direct cause with Coke or Pepsi or anything like that.
Understood. And so how often do you recommend screenings for things like that? Do you have regular physicals for people who come in for just regular checkups, or how does all that work?
My practice is a little bit different than the average urologist, but I would say even a urologist is at the specialist end of the spectrum. I think all people, over the age of 40 should probably have a relationship with a primary care doctor. And then there's a battery of tests that are done to screen for heart disease and colon disease and all that sort of thing. From a urologic standpoint, screening has some benefits of early detection, but there's also some downsides. So let's say, for example, someone went and had an attempt to screen for bladder cancer. You would have to have a sufficiently large number of people give a sample, and then the yield on someone with no symptoms, just picking them out of the shopping mall or at a sporting event, is very low, but the costs are very high. So when screening is introduced, or when you talk about screening from a medical organized standpoint, you have to look at the benefits and the detection rates. From a specialist standpoint, I would say close to 85 or 90% of the people I see already have been seen by their primary care doctor, already have had a workup by another urologist, and then I predominantly do surgical interventions, so I don't participate in a lot of screening and follow-up like that.
Understood. And so explain, if you would, exactly what is endourology. What is that, and how can a person deal with those symptoms?
So endourology is a term that was coined about 30 years ago, and it's basically endoscopic urology, whereas prior to the 1980s, urology was scopes through the urethra or to gain access to the urinary tract, but a lot of it was with a scalpel. So open surgery was replaced by this concept of let's put a scope into the inner cavities of the body, which, again, prior to the 70s, probably was limited only to the bladder. And now we have instruments that are the size of 2 or 3 strands of spaghetti that we can put in the urethra all the way up into the kidneys to do investigations, to do biopsies, to do treatment for urothelial cancers, but mostly for stone disease. So what used to involve a scalpel or a lot of pain and drink a beer to try to pass a stone, now we have interventions that are very safe, that are widely practiced by all urologists, and I end up seeing the ones that either aren't so straightforward or that have specific anatomy like obesity, or they've had reconstruction. So I really, my practice is very specialized, but obviously as a urologist, I've been trained and I've seen things over the last 25 years that I pretty much can do everything. I just don't want to do everything because I just don't have the time to do all of them.
Of course, in a quarter century of practice, so you have seen some amazing things. What has been the most amazing development technologically that you've seen during your career?
I would say the 2 things that stand out most are the smaller scopes with the lasers to treat diseases inside that I alluded to a minute ago, but probably the surgical robotics and laparoscopy have been a game changer. I mean, you make 3 or 4 incisions into the abdomen, you inflate the belly with carbon dioxide gas, and then you can manipulate things and take out parts of organs that we just couldn't do before. We used to be relegated to kidney surgery through a very painful 12-inch incision under the rib cage or taking out a rib to gain access to the kidneys, and now we can do virtually everything with a small scope.
When do you typically see people begin to develop kidney problems, would you say?
I would say the peak ages are between 50 and 70, but we see some as young as 20s, and rarely after age 70 do we see that many, unless they have an anatomic problem, a blockage somewhere. But I'd say your peak age is going to be 40 to 70.
Understood. And so people like to say we have a diabetes epidemic, and certainly we could make a case for that. And diabetics are certainly, that's one of the issues that they have, kidney failure. Speak to how you treat a diabetic when they're running into some problems.
Yeah, so diabetes is a disease of blood sugar metabolism, and if you take as a whole diabetes as a complex, something called a metabolic syndrome, with being overweight, having a poor blood sugar control, cholesterol, and heart disease problems. Those patients tend to be higher risk for forming stones, and it's not understood exactly why that is, but there is a sub grouping of patients that have diabetes as a primary problem. I wouldn't say that that's the majority, however. I mean, when somebody that needs surgery has diabetes, we consult with their medical doctor and they get their surgery, and then we give them whatever medications are required, whether it be insulin or an oral agent, and that's done in a team approach. So as a surgeon, I have given up a long time ago trying to manage somebody's blood sugars. I am in the hospital, we would consult with a medical team, and that's the subdivision of medicine that I've witnessed over the last 25 years.
Okay. Well, that is a lot of outstanding information so far in our broadcast. And so we're going to take a quick break, and we'll be back right after this.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We are back with Dr. Raymond Levely, and we want to make sure that we share this gentleman's place of practice in Boynton Beach, located at 2800 South Seacrest Boulevard, Suite 140. And the number that you may call to schedule an appointment is 561-734-2746. Say that one more time, 561-734-2746. And so, Doctor, during the break, we were talking about some of the attributes of robotics and how they can make a positive difference in the lives of patients and make it easier for you to treat someone after the proper diagnosis. Speak to that if you could.
Yeah, I think at the beginning, 20 years ago, robotics was looked at as a fad, and many older surgeons would downplay the benefits of minimally invasive surgery. But over the last 20 years, I think that there's been significant advantages with respect to the technical aspects of the surgery. So, for example, it is not robotic surgery that runs by itself like you would see in a car factory, where you put the parts there, and it's so. What I like to think of it as like a puppeteer pulling several strings at the same time. So I am able to use 4 instrument portals at the same time, including controlling the camera and a right and left hand, and I have foot controls, I have hand controls, and so it's like playing an instrument, an organ, and it's very well orchestrated. At the bedside is the surgical assistant, and I think of that person like the caddy. So if I need a 9-iron, they put that instrument in. If I need a particular suture, so it's very well orchestrated and coordinated. And the advantages are improved vision, decreased blood loss. We work in a pressurized cavity, so therefore bleeding is a lot less. And when you don't bleed and you can see as a surgeon, you can get cleaner margins, you can do a better repair. So bleeding is the enemy of the surgeon. And the robotics really improves on that. And also from the patient standpoint, less blood loss. You don't feel weak after surgery. You typically can eat faster. And it's estimated that compared to open surgery, the recovery time is about 50% less, or half, in terms of getting out of the hospital. And in terms of the long-term recovery, we used to keep people out for 6 weeks. Now, by 2 weeks, they're off to all their pain meds and they're asking, can I go back to work? And so I think that there's a significant cost benefit to society for people to go back to work sooner. I think that people feel better quicker. And, it's still surgery. There's going to be some pain. There is still some use of narcotics. But I think the opioid crisis also has forced patients to say, I don't really want that. That was a societal problem. And it dated back to when I was in med school. We were told to give 50 tablets so people wouldn't have to suffer or they wouldn't call. And now we realize that we were part of the problem, not me as an individual, but my teachers told me, give them enough so they don't call the office, and that was a mistake. So I'm glad that the government has kind of helped set the tone to cut back on pain medicine use, because really, if I give somebody a dozen tablets, they usually don't even take them when they're home, and that's for kidney removal, prostate removal. You're talking about pretty major surgeries, but because the incisions are only 1/4 of an inch, there's not a lot of pain. It's mostly cramps and gas pains, and so those resolve in a day or two.
Well, that's really remarkable, and it's safety first with everyone, right? And here we are with the robotics coming into play and making everything more efficient and assisting with getting people off medications like that much more quickly. That's a highly significant development in your field.
And I think the initial thought was that robotics was a fad is absolutely false. I think the future is going to allow for artificial intelligence, intraoperative mapping. You'll be able to take the tumor and project it inside the body. Right now, I look at a CAT scan and I've got to think about where it is. We have 3D modeling that we can utilize now, but I still have to look at a model, something that might look like this, and then I can project, on my phone a little tumor. But the day's coming soon where that'll all be automated, and the exposure and where to clamp will be defined by the computers will tell us, but we'll still control it. It will never be autonomous surgery. It'll always be a human interface. So for people that are afraid that the robot's going to take over, no, there'll always be doctors. There'll always be the potential for something that is not on a computer algorithm where you need a human in there. So I don't think surgeons are going to be out of work anytime soon.
Understood. And we have less than 4 minutes left to go now. And so you wanted to talk about some bullet points for people and things for people to remember as they consider the kidney. You held up the heart-shaped kidney there and explained everything very well. What can you comment about regarding that?
Well, I think that the main bullet points, and we have such a short time here to dive deeply into anything, I would say don't ignore symptoms, whether it's a urological symptom, but anything that you perceive as altering your normal daily habit, whether it be pain, or you see blood in your stool, or you see blood in the urine, or you have a fever. I mean, the key things are don't ignore your symptoms. And then if you're given a preliminary diagnosis, an abnormality on the x-rays or the CAT scan, it doesn't always mean that you have cancer. Go to see a specialist, get the proper workup, and oftentimes these things are either really small and we find them early and we can fix them, or they don't need fixing at all. And, there's many different options for kidney stones, and there are also many options for renal masses, including doing nothing and watching them. And so those are the bullet points. Don't ignore your symptoms. Don't freak out if you see blood in the urine, and get proper medical care.
Well, that's invaluable for all of us to know, and trust your instincts, trust your gut, and if something doesn't seem right, get in and see your urologist considering kidney operations. Yeah, absolutely. Well, we appreciate that so much tonight, Doctor, and thank you for being here and sharing your wealth of knowledge. And this does conclude our broadcast for tonight, and we'd like to again thank Dr. Raymond Levely, urologist, available to serve us at his practice in Boynton Beach. Thank you for watching and listening to our broadcast as we work to make you well aware of our dedicated medical practitioners here in South Florida, like Dr. Levely. Wishing you continued safety, health, and wellness as we move towards November here in South Florida. Thanks for tuning in. Take care, everybody.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having